Hello and welcome to Wave Clinical Support. I see from your case that you've got a patient who's previously worn gas perm contact lenses for a number of years, and you're switching to wave lenses trying to fit in more of a semi-scleral or a scleral lens and struggling a little bit with fit as well as the vision. So let's take a look here for a moment, see if we can make a couple of recommendations for you. First thing I noticed kind of looking at your topography is this right one. Actually looking at both of them, it looks like this patient is probably keratoconus. I don't know if it says that, if you shared that with me in your request, but it almost looks like a keratoconus patient, so I'm going to kind of look at that in sort of that terms. We do have a lot of what looks almost like warping in here. I suspect that's probably from previous gas perm wearing. And just kind of a little side note, what I find very helpful in these patients, if we can, to try to have them not wear the lens for a day or two before we get our topographies. And I know that's not very practical most of the time, but when it is feasible, I try to ask the patient maybe at least stay out of their lenses the night before, come in the first thing in the morning, get some fresh topographies, and just double check at the end point of the refraction to see if we can get a little bit better data. I've sort of found through the hard way through a lot of trial and error and a lot of refits that often goes a long way to getting these lenses a little bit more successful. But with that said, obviously you and I both know that we have to work with what we have to work with in most of these cases. So let's take a look at what we have. So if you look, I know that you mentioned that your left design seems to be working a little bit better than the right design. And I think that, and you can see they're very similar designs. I suspect that because we have a little bit better, a little more symmetrical data here in this left eye than the right one, that it's just allowing that left lens to sit a little bit better on the eye. And it looks like you're working with a scleral design here. If you remember, there's basically scleral designs where you rest the lens on the sclera and you try to vault the entire cornea. And there's also sort of a semi-scleral design where you basically have a corneal touch, but you just kind of rest most of the bearing on the sclera. And I'll just talk about both designs for a moment. I've actually had a little bit more success, actually a little bit more experience with these semi-scleral designs. But we'll talk about scleral here for just a moment. The left eye, since you're doing reasonably well, I'm just going to tuck that aside here for a moment. If we look at this right design that you have, I would probably try to get this a little bit less vaulted. It might be a little bit too much for this particular case. And unless you haven't, I think you probably use this semi-scleral tool. But if we use that, we'll let the software do a little work here for a moment. And this has been a very helpful tool for a lot of wave designers. And it gets you pretty much in the ballpark on a full scleral lens. And quite often when you get this in position, should be just about done. There we go. And we got a lens now that's finishing up. There we go. And if we spin this around, you kind of see that we've got a lens that is a little bit lower now. We don't have quite as much clearance. We're more like 125, which you can actually do if you want to bring this down to 15. You just really have to just bring this down to 15, and you'll actually probably do quite well with that design. That's one possibility. The other thought is going to more of a true semi-scleral lens where you actually have a little bit more contact here through the cornea, and then you try to rest the area, the bearing area out here on the sclera. And I sort of started a design, and if you haven't worked with one of these designs yet, I'd recommend that you go to the Wave Clinical Training website, and I'll include a link to that in the email that I send. There's a great video on there one of the other wave designers put together on how to design a large diameter lens using this tool, and he talks about the 8-point step, and it's really been a helpful tool. I've fit a number of these lenses now, and I'm finding that they're very easy to fit, and they seem to be pretty successful. So what I did is I sort of mocked up one based on the 8-point design at a 15mm like you have. Basically the tool that you would use is this under Tools, Configuration Settings, and you can just basically set your parameters here. The video talks about how to set your optical zone and IC width, talking about larger bevel and center thickness. You set your diameter here, and then let you axial, GSIM, and you let the software design. It'll just cancel this out. Once you do that, the video will talk about how to get some central clearance, how to create a nice tear pump here centrally, how to pin the pink dot up to get enough edge clearance, and voila, you have a lens that clears the cornea centrally. It does most of its landing out here in this area, and if we look at our topography, it kind of gets landing out here beyond that area in the flatter area of the cornea. And again, these lenses seem to work pretty well, and you've got a 15mm lens. So I think either way that you go, you should do reasonably well with this patient. Again, I encourage you to see the video on how to design a large diameter lens. And with that, I think you'll do quite well with those adjustments, and I wish you well with this case. Thank you very much for contacting Wave Clinical Support, and have a great day.